Welcome back, ladies and gentlemen. As Middle East countries ramp up vaccine plans, the region is already home to some of the highest inoculation rates in the world. This session, ladies and gentlemen, focuses on the work that is being done across the region to vaccinate all citizens and residents and the lessons learned to date. Examine any ongoing challenges and how these are being addressed. And finally, examine the role the region can play in supporting the efficient and effective delivery of vaccines to other parts of the world. Ladies and gentlemen, with that said, we would like to welcome to the stage the following panelists. And they are Her Excellency Dr. Maryam Ibrahim Al-Hajri, Assistant Undersecretary of Public Health, Ministry of Health in Bahrain. His Excellency Dr. Hani Jokdar, the Undersecretary of the Public Health Ministry of Health in Saudi Arabia. His Excellency Dr. Hussein Abdulrahman Al-Rand, Assistant Undersecretary for Health Centers and Clinics and Public Health, Ministry of Health and Prevention in the United Arab Emirates. Ghassan Aboud, Chairman of the Ghassan Aboud Group and founder of Orient Human Relief. Mr. Simon Bland, Chief Executive Officer at Glide. Dr. Rana Haji, Director of Program Management at WHO EMRO. And the panel moderator, Mr. Greg Kallstrom, Middle East correspondent at The Economist. Please welcome them.
Good afternoon, everyone. Welcome back, and thank you for joining us this afternoon. My name is Greg Kallstrom. I'm a Middle East correspondent for The Economist based in Dubai. I'll be moderating this session for the next hour or so on vaccine distribution in the Middle East with a focus on this region. As you can see on the screen, we have quite a full stage of panelists here with us this afternoon, so makes my job very easy. I'll keep my own remarks very brief, and then I'll get out of the way so that you can hear from the people who are actually working on this issue. But by way of introduction, I think we've seen over the past few months everywhere in the world real disparities in how vaccines have been rolled out. You have some countries that are racing ahead, that are well supplied with vaccine, that are moving quickly to distribute it to their population. You have other countries where it's gone quite slowly and people are getting increasingly frustrated at the slow rollout of vaccine. And I think nowhere is that disparity clearer than in the Middle East, where you have, on the one hand, countries like Israel and the UAE, which are number 1 and number 2 in the world, respectively, for the number of doses they've administered per head. Israel's administered about 110 doses per 100 people. The UAE has done 80 per 100 people. Both countries plausibly on track to hit sort of herd immunity levels of vaccination in the coming months. Whereas you also have countries, on the other hand, where things are going very slowly. Lebanon, for example, where I was based until recently, they're about 6 or 7 weeks now into a vaccine rollout. They've administered about 3 doses per 100 people, which is a pace where it's going to take years to vaccinate a critical mass of the population. So very stark disparities, which are a problem not only for individual countries where they lead to unnecessary illness, unnecessary death, but also a problem for everyone, because among other things, as we've seen over the past few months, virus variants that spring up in one country or another don't respect national borders. So to talk about that with us this afternoon, we have, as you can see, 6 panelists joining us, representatives of national governments, of nonprofits, of the humanitarian sector, and also of the World Health Organization. So to go through and introduce our panelists from left to right on your screen, first, Dr. Maryam Ibrahim Al-Hajri, who is an Assistant Undersecretary of Public Health at the Ministry of Health in Bahrain. Dr. Hani Jokdar, who is an Undersecretary of Public Health at the Ministry of Health in Saudi Arabia. Dr. Hussein Abdulrahman Al-Rand, who is the Assistant Undersecretary for Health Centers, Clinics, and Public Health at the Ministry of Health and Prevention here in the UAE. Ghassan Aboud, who is the chairman of Ghassan Aboud Group and the founder of Orient Human Relief. Simon Bland, who is the Chief Executive Officer of Glide, the Global Institute for Disease Elimination, and Dr. Rana Haji, who is the Director of Program Management for WHO EMRO, the World Health Organization Regional Office for the Eastern Mediterranean. Thank you, of course, to all of our panelists for joining us this afternoon. We'll go in order across the screen. So we'll start with our 3 panelists from governments in the region, who of course represent governments that, although they are neighbors, are in countries that are very different in terms of geography, demographics. Some of them are using different vaccines. They're at different stages in their vaccine rollout. And so, Dr. Mariam, if we can start with you to talk about Bahrain and talk about the vaccine distribution there. If you can tell us sort of where you are, what's gone well, what hasn't gone well, what challenges have come up, how has it gone compared to what you expected a few months ago when Bahrain began this process?
Bismillah ar-Rahman ar-Rahim. Thank you, Mr. Greg. It's my pleasure on behalf of Ministry of Health and Task Force in Bahrain to be here with you today in very important summit hosted by Hope Consortium. A sincere thanks to Hope Consortium and the organizing committee in making the World Immunization Logistic and Logistic Summit very successful event. Regarding your question, Mr. Great, about Bahrain experience with the vaccine COVID-19 and responsiveness and efforts and challenges. Since the beginning of the virus spread globally, the government of Kingdom of Bahrain has taken the responsibility for maintaining the health and safety of all segments of society, citizen and resident. The Kingdom of Bahrain implemented a strategic approach to the vaccination deployment through a well-organized system and protocol set by the National Task Force for Combating the Coronavirus COVID-19 under the supervision based on the direction of Executive Committee headed by His Royal Highness Prince Salman bin Hamad Al Khalifa, the Crown Prince, Deputy Supreme Commander and Prime Minister. The Kingdom of Bahrain anticipated the arrival of vaccine early in the pandemic, starting from participating in phase 3 clinical trial of the SARS-CoV-2 inactivated vaccine from Sinopharm company from China in collaboration with United Arab Emirates. And I would like to thank United Arab Emirates for all support and cooperation with Kingdom of Bahrain. As you know, Bahrain launched the national vaccination campaign in early December 2020 with the objective of securing access to the vaccine for all citizens and residents, as I mentioned, that met eligibility criteria and priority target group set by the Immunization Committee in Bahrain after approval of the vaccine for emergency authorization by the National Health Regulatory Authority. His Majesty, the King of Bahrain, Hamad bin Isa Al Khalifa, direct free vaccination to provide for all citizens and residents free of cost. And 5 types of vaccine against COVID-19 were approved by the National Health Regulating Authority and the National Immunization Committee under emergency authorization after accessing provided documents and interim analysis of phase 3 trial of the corresponding vaccine from the manufacturer to ensure its related safety and efficacy prior to introduction to Kingdom of Bahrain. Moreover, the process of vaccine against COVID-19 started by online registration of the candidate through a mobile application to manage the flow of participants and ensure availability of stock to satisfy the requirement. And the vaccine are not mandatory in Bahrain and only offered to those who have willing register. And regarding the places of vaccine, many places have been dedicated for vaccination, including primary healthcare center, exhibition center, 3 main hospitals in Bahrain, and 1 shopping center to accommodate larger numbers of the population in the Kingdom of Bahrain and to provide easily accessible services throughout the country to ensure protection of the targeted group in a short time. In addition, we have a vital services mobile unit aimed at facilitating vaccination at home for elderly and special need, and also by booking an appointment through Ministry of Health. Meanwhile, a multilingual media campaign was launched, deliver information about the vaccine to people across all government, and the National Task Force has relied on transparency in its attempt to convince the public of the vaccine safety and efficacy. Since the start of vaccination campaign, as I mentioned in December 2020, against COVID-19 infection in the Kingdom of Bahrain, high uptake of the population was noted that indicate high level of community engagement and the trust of the health services in Bahrain. Regarding the challenges, in the beginning, we getting Bahrain on the vaccination roadmap, considering the size and population of Bahrain, getting supply in accordance to our immunization plan, which put by the task force team, we have a difficulty in the beginning. However, with perseverance and through efficient bilateral contracts, we were able to get vaccine on time. And regarding the challenges with cold chain challenge, the vaccination storage facilities along with the vaccination location in Bahrain were prepared in record-breaking time to accommodate for the logistic need of different manufacturers. And through comprehensive contract, we were able to tackle border closure and other prioritization of supply to country of origin, ensuring that our vaccination program remain unaffected. This is a story or an Bahrain experience with the vaccine till today, 30 of March. Thank you. And I would like to again, to thanks the Hope Consortium for this very important and helpful and success event. Thank you.
Dr. Mariam, thank you. To move now to your right and across the causeway to Saudi Arabia, Dr. Hani, you are, of course, a much larger country than Bahrain, not only in terms of population, but in terms of area. And so that I'm sure makes the logistics of getting vaccinations to people quite different, because it's not just a small island that has to be vaccinated. It's a much larger country with people spread out across the country. You're also at an earlier stage in your vaccine rollout. Talk us through what your experiences have been like to date in Saudi Arabia.
Hi, thank you, Greg. First of all, I'd like to thank you and the organization committee of this consortium, and also the very well prepared World Summit. Second, I'm really honored to be a partner or speaker in this very valuable gathering. And just let me go back to the Saudi Arabia and what happened in this pandemic. Actually, in Saudi Arabia, the leadership supported this fighting against COVID-19 from day one. We actually started, prior having any case in Saudi Arabia, formulated a ministerial committee that is led by the health minister, and engaging all other entities. More than 20 other official entities in the country are in this committee. We used to meet daily, actually, until August last year. And then from August, we started to meet 3 times a week. Until today, we are meeting. We met nearly 200. We had a 200 meeting since we started last year until today, as we speak. So it is a very precious meeting or committee that meets, as I told you, so frequently, led by the health minister himself, and other entities are in there. And also Saudi Arabia believed that from the beginning that the vaccine is it is a goal for the whole world to land on the safety zone of this pandemic. We might not get rid of the virus, but we need to have a safe zone that all countries should reach. And Saudi Arabia has given or dedicated itself as a country to be part of the leading role in reaching that zone by donating $500 million to the ACT accelerator. Saudi Arabia split the money between investigation, treatment, vaccine development, and vaccine distribution through Gavi and through the COVAX. So Saudi Arabia is really believing that we need to have the whole world reach out to the vaccine in equity and safety and security. We also actually in Saudi Arabia, we believe that the people health comes first, and that was the first speech by the king early on the when we had the first case in Saudi Arabia. There was a speech by the king early on the disease, and he said that people's health come first, where we focused in the beginning on test and trace, isolate, and then we offered the management to everybody with equity, no difference, and that gave us actually a very, let's say, frontline service where everybody in Saudi Arabia, including illegal residents in the country who do not have legal presence, they were offered the treatment with no consequences from the emergency room to the ICU and so forth. And then we came to the vaccination. Saudi Arabia committed to give the vaccine free of charge to anybody who lives on this land. And there is a process in the vaccine delivery in the country, started by the licensing, which is the Saudi FDA is responsible for, and then procurement, which is the responsibility of the government. Actually, the government took the role to purchase the vaccine for the country, and then MOH created their vaccination center, and they were a fantastic center. We've seen it on the media everywhere. We started in Riyadh on December 17 last year, and then in Jeddah 4 days ahead was 21st or 22nd of December, and 2 days later on the Eastern Province. And these mega centers were replicated across the country on the 13 region and the other 7 districts where we have healthcare health directorate authority. So we have 20 mega centers across the country, and now we are having more centers in Riyadh. That was by end of January. Now we have 3 more centers in Riyadh. We have 2 more centers in Jeddah and 2 more centers in the Eastern Province, and we are distributing the vaccine everywhere. Our target is to roll out the vaccine across the country and to reach out to 70% of the population before Hajj, inshallah. And we are in a phase now where vaccine is given to other governmental sectors to help in the vaccination. We have the military, National Guard, universities, and Royal Commission. All of them, they are providing vaccination to public. They have access to their location. I'll tell you how. We also have we have also started in the private sector, where vaccine is delivered in the private hospitals and some of the private community pharmacies, free of charge. And it's on the account of the government, actually. And the vaccine, how do people reach out to the vaccine in military or National Guard? In the beginning, people thought that how can I get the vaccine in the National Guard? It is very simple. We have an app which is called Sahati, where everybody is registered, and you will see all the service points or provider of vaccination are listed. So you just pick your place that you want to go. King Faisal Special Hospital, National Guard, or military hospital, you pick it, you book your time, you go. In the beginning, we took like a month, no, 2 months actually, from mid-December until mid of February. We focused only on the first and the second category, which is healthcare worker and people above the age of 65. Then we drop down to 60 and then down to 55. And after that, from mid-February, we open the vaccination for everybody in the country. So anybody now is capable. Anybody is capable to register and take the vaccination immediately. And appointments are listed on daily basis. On daily basis, we offer. I can hear some noise. Sorry. On daily basis, we give more than an average of 150 doses across the country. We have much higher goals than that, but we are awaiting for the further procurement. So in the near future, we will hit much higher number than 150,000 doses per day. And finally, what we are looking forward is to have our authentication. You know that we are in Saudi Arabia. We are going to have Hajj and Umrah very soon. So what we want to make sure that we have an official authentication of the vaccination. We in Saudi Arabia, anybody who get the vaccine, he get a QR code that is authenticate the government. So it is government responsibility of the single trove of information about the vaccine. So we are looking forward to have all countries to have an authentication process that is easy and readable in our borders. So for people who get vaccinated, they can enter seamlessly into the country if they are vaccinated. So we are looking forward to have a full package, starting from licensing of the vaccination. We have 2 vaccines licensed right now, Pfizer and AstraZeneca. Going down the road, we'll be having more vaccines. We want to have easy procurement, easy delivery, and as well as registration and authentication of the vaccination. So this is from my side. Thank you very much.
Thank you, Dr. Hani. Moving to Dr. Hussein for a very similar question to you. The UAE, I suppose one difference in the Emirates is the fact that it's a federal system, the fact that you have different health authorities. You've had at various points different vaccines being used by different Emirates, various different criteria in the different Emirates for receiving a vaccine. How do you stitch all of that together into a sort of a coherent nationwide vaccine campaign?
First of all, thank you, Greg. It's my pleasure to be with you all during this summit for international vaccination and the logistic summit for immunization. United Arab Emirates has done the study, first of all, with the Sinopharm vaccine, which is phase 3, done on 31,000 people from different nationality, which is done in Abu Dhabi and Northern Emirates. And when we found that all is safe, then there was an emergency registration in September, and Ministry of Health and Prevention created a roadmap for implementation of vaccination rollout in United Arab Emirates based on offering the COVID vaccine to its citizen and resident free of charge, and on optional basis after ensuring that the person has no condition or symptom that make it inadvisable, according to the priority announced from time to time by United Arab Emirates Health Authority, which is, as you know, Abu Dhabi Health Authority, Dubai Health Authority, and of course, Ministry of Health and Prevention, to get dynamic way of the operational planning. In United Arab Emirates, there was a main key factor to create ecosystem in the country, which is the political and high leadership engagement, earlier preparation and planning, multi-health stakeholder cooperation and participation of other entities, efficient and resilient health system infrastructure to accommodate the change needed for mass vaccination, innovation and expanding the national vaccine registration process, a strong media and health awareness campaign targeting the priority group. The UAE related authority are planning synergistically through national team for COVID vaccine administration in order to use current COVID-19 vaccine portfolio for administering its different licensed vaccine to those who are eligible, either through making appointment or walking into the designated vaccination center and clinic, which is scattered all around the United Arab Emirates. In addition, different scenarios have been administered for vaccination issuing where COVID vaccine is to be given to citizen and resident above the age of 16 and starting with frontliner in healthcare facility and vital sectors and focusing on elderly and those suffering from chronic diseases as priority, so as to ensure providing the protection for those who are at risk for diseases, as well as vaccine is available for those who are above 16 years. Ministry of Health and Prevention also introduced 4 types of vaccine in the country: Sinopharm, Pfizer, as well as Sputnik from Russia, and also the Oxford vaccine, which is AstraZeneca. Thank you very much.
Thank you, Dr. Hussein. Okay, to zoom out a little bit now and to get away from individual countries, we'll move to Ghassan. Of course, your organization has worked over the years with Syrians in Syria, in refugees in neighboring countries. And unfortunately, when we talk about vaccine distribution in the Middle East, refugee communities are a big part of that. Of the 80 million or so people who are displaced around the world, a disproportionate number of them are in the Middle East, whether it's refugees in countries like Lebanon and Jordan, or internally displaced persons in countries such as Yemen, where millions of people are displaced. Ghassan, if you can give us your thoughts on, first of all, what sorts of preparations have been put in over the past year to distribute vaccines in these communities, in places where even basic healthcare is often difficult to find, and also what more needs to be done to make sure that these communities have access to vaccines.
Good afternoon, Greg, and thank you very much for you and for the people who they are behind this nice organization. It's an honor for me to be with you. Actually, when we speak about the conflict area, we go to the different way. First of all, of course, maybe the vaccine is the last target for the people who they live in the conflict area. For them is more important, of course, the food and the bread and etc. But of course, unfortunately, also maybe nobody talk about them that what they need. And if they need vaccine and etc. Since now we are nearly 10 years, we are in this, we establish Orient Humanitarian Organization. Of course, we make around 72 medical points plus many hospitals. We cooperate with UNICEF and also the World Health Organization. Of course, also we cooperate with multi-facial lines. There are around 100 NGO based in New York for Syria only. With this organization, actually we provide the Syrian people around $200 million for in the medical area. Actually, we Orient organized more than 30 vaccination campaign in Syria against polio and MMR. All campaigns were supervised by UNICEF and also World Health Organization, WHO. Orient also was able to give the OBV to more than 800,000 children aged between 0 and 5 years. In Turkey, more than also 5 vaccination campaigns have been coordinated, and more than 20,000 Syrian children we help. we face, of course, many problems, which is all the time. I think it's all the conflict areas available. That all the time there is electricity shortage. So we were unable to operate temperature control units and refrigerators. Of course, there is a lack of experience and trained human capital. We were also operating under missiles and airstrike, and also difficulty to reach rural area due to the destroyed infrastructure. Meanwhile, in these 10 years, actually, we do our best to train people and to make them ready for this. And of course, we have also the other situations that most authority there, they are illegal or unexpectable government or not cooperated with the United Nations and also the international world not cooperate with them and not recognize them also. For that, of course, we all the time advise and we talk with our, with the international health organizations that the best way to cooperate with UNICEF and also with the World Health Organization for this. You know that also the people who they live in conflict area, they have horrible circumstances. For that, they don't trust at all the circumstances around them. It's hard to make them believe about vaccine because they think, and mostly they think that the vaccines can be kind of weapons to kill them also. In this area, we have Orient Media, which is very appreciated from Syrian people. Actually, I talk about Syrian people. And this has helped them all the time and communicate with them that they should go and trust to take vaccine. For that, really, we arrived nearly for 1 million children last 8 years in this area. Of course, we just need the world to understand that also there is millions of refugees, not only in Syria, and also they deserve as a human to have a vaccine also there. Unfortunately, now 1 year run with pandemic, maybe over than 1 year, around 15 months. Nobody speak about refugee, that they need this. Of course, we are ready to cooperate with any government who they would like to help. And we think that as an Oriental humanitarian, we have this infrastructure to help, especially if it will be AstraZeneca. It's more easy for us because it's need the freezer refrigerator from 2 to 20, or maybe we can cooperate with also vaccine which has come from China. But Pfizer for us is too hard there because it's need around minus 80 degrees, and we are not able, and I don't think anybody able in the conflict zone to do it. I appreciate and thank you very much.
Ghassan, thank you. Simon, if you can give us maybe a big picture here. I think we've seen over the past few months, governments around the world are sort of laser focused on vaccinating their own populations first, which is an understandable impulse. And you would think as they get closer to achieving that goal, that governments might then be more willing to share, if you will, to give surplus or unused vaccines to other countries. But then also looming in the background is this question of how long these vaccines will be effective for, at what point we'll need to do another round of booster shots, perhaps. And so that might make politicians or government officials reluctant to spread the wealth, if you will. So how do you balance, or how do you reconcile the global need to give everyone a vaccine with this sort of national imperative to make sure that your own national population has been vaccinated?
Thank you very much. I'm delighted to be here with this speaking panel, and I've learned a lot from the country perspective. So I'm delighted to be with you. Let me just say a couple of words about the Global Institute by way of introduction to this quite thorny and profoundly political challenge that you laid out here. The Global Institute for Disease Elimination is located here in Abu Dhabi. We were launched in November 2019, really building on a long-standing partnership between His Highness Sheikh Mohammed bin Zayed, the Crown Prince of Abu Dhabi, and the Bill and Melinda Gates Foundation. We're focused on accelerating the elimination of preventable infectious diseases of poverty. That's currently for us malaria, polio, and 2 neglected tropical diseases, lymphatic filariasis and onchocerciasis. And while we're rooted in Abu Dhabi, we partner locally and globally to advance and accelerate progress towards elimination. So we launched this organization in November of 2019 with an inaugural board meeting. By our second board meeting of March 2020, the world had changed dramatically. The board considered at that stage, really, well, how are we going to take account of COVID-19? What does it mean for this new institution and its ambitions, given that we were very much in startup mode? We agreed that we couldn't take on COVID, but we had to take account of COVID. And it was clear we couldn't just stand back. There's no such thing as business as usual. So we thought we'd need to consider how we could best help prevent and minimize backsliding, eroding the decades of progress towards disease elimination more broadly. We thought there were the ability to identify synergies and lessons from some of those programs over the last decade. So health systems, routine immunizations, community health, mass drug administrations that have been routine for decades now. And also repurposing assets. For example, all those assets that were focused on polio programming in Pakistan were really repurposed to deal with COVID in the very early days. So there's some lessons to learn from that. And more specifically, we want to lend our voice to a collective, coherent and multilateral global response to the pandemic. And therein lies the challenge, Greg, in terms of the political imperative of protecting one's citizenry, with also the notion that no one is safe until and unless everyone is safe. And if we have an imperative to save the most lives, then protecting the most vulnerable first would be the way to do that. But that doesn't necessarily play out domestically and is not that easy to do. Let's just think about where we are for a second. The research, discovery, and clinical trials have happened at a pace unprecedented in human history, and in large part because of global cooperation on that research agenda. I think if anyone had asked 9 months ago, what's a good outcome in terms of a number of vaccines, if we'd said we'd have a whole suite of vaccines of very efficacious nature and very safe, people would have been extremely comfortable. The fact that there was at-risk investment in manufacturing capacity, not waiting for clinical trials and the answers and then starting to think about manufacturing, was super important. Although there's need for far more investment in more manufacturing and increasing production substantially. In some ways, I see this summit on logistics also trying to not wait until we've got the global supply, but getting the logistics right now in terms of global distribution. But then also the distribution and delivery in the country. Vaccines don't save lives, it's vaccinations that save lives. And so, as one of my colleagues said, how we think about airport to arm is going to be the last mile of delivery of these vaccines. I want to say just a couple of things, and I think, Greg, you talked about the virus not respecting borders, and that's true. And I think it's artificial to think that we can self-isolate in the long term and sustainably in isolation from thinking about what happens globally. So, and I think Dr. Rana may talk about this a little bit, but the COVAX facility and the advanced market commitment as part of that, is really interesting in making it easy for procurement and easy for governments to do not only what is right domestically, but also to invest ahead of having surplus vaccine at home, but enable to invest globally for sort of pooled procurement and to kickstart early delivery and equitable access to vaccines. I remember working on an advanced market commitment about a decade ago. It typically takes 10 to 15 years for a vaccine that's developed for the West, for high income countries, to be deployed in lower income countries. An advanced market commitment for pneumococcal vaccine, for pneumonia vaccine, we managed to roll that out 9 months after it was introduced in the West. And now with COVAX and the distribution of vaccines that we've seen in Africa and Asia and in the region here, 90 days after its introduction in the West. So that's good news. It's only 90 days. The bad news, it's still 90 days. There's still a long delay between, who gets access. And so we're going to continue to lend our voice to advocate for the COVAX facility, for the AMC. We're going to push governments to invest. We're going to work with countries in the region. We're building a platform for regional collaboration to engage with and invest in the COVAX facility. And I think the easier we make it, to make those investments, the easier we send market signal, ramp up production substantially, the easier it will be for politicians domestically to make the case that vaccines need to be everywhere for everyone. Thanks, Greg.
Simon, thank you. Last but certainly not least, Dr. Rana from the World Health Organization. 2 questions for you. First, I think everyone would be interested to hear your perspective on broadly the vaccine rollout in the Middle East, what the challenges are to getting vaccinations done in this region. And then, of course, if you could talk specifically about COVAX, about this initiative in which the WHO is a stakeholder. And as Simon alluded to, it took 90 days to begin distributing these vaccines. What have been some of the, excuse me, some of the challenges or the obstacles so far to COVAX distributing vaccines, and what should we expect in the coming months?
Yes, thank you very much, Greg. Can you hear me?
Mm-hmm.
Great. And good morning, good afternoon to all colleagues and to the audience. And thank you again for including me in this important meeting. Of course, when you are the last speaker, a lot of things have been said, but this allows me actually to maybe just make comments and highlight some of the issues that have not been fully covered. And it's been wonderful to hear about all the achievements in many of our countries that, of course, as a regional office, we are quite familiar with. But I learned even new things today, so it's great, and really congratulations to very successful rollouts in many of our Gulf countries. It's been very impressive. Also, nonetheless, it is, as always, heartbreaking to hear about what some of our less fortunate countries in the region, especially countries that are in conflict and are dealing with a lot of humanitarian issues, are also going through, like Syria, Yemen, and many other countries. Maybe if I can just step out for a second, Greg, because this is, I know the focus of the summit is on immunizations, but I take every opportunity since we are entering into the 2nd year of the pandemic, and we're actually experiencing almost the 3rd wave right now of the pandemic in the world and in our region. Just wanted to put the whole vaccines issues in the context of the overall pandemic management. So we have, as a regional office, we have been working very closely with our countries. And just by way of introduction, the Eastern Mediterranean region includes most of the Arab world. It's 22 countries, most of the Arab countries, in addition to Pakistan, Afghanistan, and Iran. And half of our countries are actually in some kind of conflict or dealing with the humanitarian situations, almost 11 of the 22 countries. So huge diversity. As our regional director, Dr. Ahmed Mondari, likes to say, we have a very dynamic region, we have a very diverse region, but also we have a region that has extremes in terms of health services and access to various opportunities. So the way we have been managing overall, I mean, the vaccine pillar, what we call, is part of 10 pillars that we are managing the pandemic. And I would like to emphasize that at least for this year, the vaccines are not going to be the only way we will control the pandemic. So it's very, very critical for all of our countries, it's important for the audience to know that vaccines are really our magic bullet. But at least for this year, and now we have Ramadan coming up with all the expected gatherings, despite the warnings that we need to continue to enforce as much as possible, despite the community fatigue. We need to continue to enforce all the other social interventions that have proven to be really the only way so far that we have effective control. So this brings me to COVAX and the role of WHO in terms of vaccine management. I am actually happy to say that COVAX, all of our countries in the region, the 22 countries, became part of COVAX. And COVAX, just quickly, I mean, WHO is not just engaged in COVAX. WHO is one of the three major organizations that are responsible for COVAX, in addition to Gavi, of course, and CEPI, which is the Coalition for Epidemic Preparedness, which has focused more on the vaccine research aspects. WHO is focusing on all the policies and guidance in terms of vaccine allocation, and Gavi is focusing on all the procurement and distribution issues, which is done also in collaboration with our sister agency, UNICEF. The main purpose of COVAX was to ensure equity, not just access, equity. And this is our biggest challenge. As you mentioned rightly in your introduction, we have huge issues in terms of access in our countries. So we have a whole spectrum of coverage of vaccination ranging from 80% to countries that have yet to start vaccination. Maybe a couple of issues before I get to the current status of where we are in terms of access, because I think it's very important to highlight what it takes for a country to even get a vaccine through COVAX, and why it's very important to have strong systems to start with before a country can before we can put a purchase order for a country to access it. So countries had to meet various regulatory and systems issues, including being able to manage the indemnification and liability from the manufacturers, being able to have the regulatory systems for approval under in their regular at the national level, and also to be able to issue the import licenses and all of this. And this is why we saw that countries that had strong systems, and what we heard already from all of our colleagues from Saudi Arabia, Bahrain, UAE, having strong systems in place proved to be extremely useful to ensuring a smooth rollout of the vaccine. Even what we heard from Syria. Syria used to be one of our strongest EPI programs in the region, but years of conflict in Syria and many other countries in the region had led to significant weakening of these systems, which is also one of the main challenges we are facing currently to ensure these countries are able to receive the vaccines through COVAX. As you know, WHO's role is beyond COVAX, because through our SAGE committee, our strategic advisory group of experts, we have been issuing the guidance on reviewing all the evidence and issuing guidance on which vaccines are recommended. WHO has also been issuing all the emergency use listing, which is kind of like the accelerated process instead of going through the long process of pre-qualification. And we have been working on developing an allocation framework to ensure that vaccines are distributed as equitably as possible. Where are we now in terms of vaccination? So far, we have 20 of our 22 countries have actually started immunization, which is great. I mean, this number by itself, I think, is very important to know. We have only 2 countries. Yemen is expected to get vaccines from COVAX at the end of the month, and we have still Libya, which is supposed to get vaccines soon, hopefully before mid-April, but we don't know yet. And many of the countries, even the ones that are part of COVAX, as you heard, had their bilateral agreement with the manufacturers, which is fully understandable in view of countries really and the global race to ensure that all the countries have their own people vaccinated. In terms of, I wanted to address specifically the issues of the vulnerable populations in the region and how is COVAX dealing with this. So we encourage all of the countries to include the refugees and migrants and other vulnerable populations as part of what we call the national vaccine deployment plans. And I am very appreciative actually of what we heard today, which I know it's really happening. That in many of our countries, the refugees and the migrants, workers, and even the non-nationals were included in these plans. But what COVAX did, just to be on the safe side, they also allocated 5% of their funding for what we call the buffer funding for humanitarian use. But this should be last resort. We would like the countries to do it as part of their vaccine deployment plans, and we thank countries that have actually contributed so far in terms of donations, either directly with vaccines or with funding to support countries in our region. We would like to see more donations, of course. We have received donations from some of the partners and donors outside the region. For example, the EU donated about $2 million to vaccinate refugees in Zaatari camp in Jordan, Syrian refugees in Zaatari camp, which is appreciated. But again, I mean, this is just the tip of the iceberg, and a lot more is expected. And maybe, I'm sorry for taking a bit longer. There's a lot to talk about, and it's a plea actually, because we are struggling to make sure everybody in the region is covered. And as you mentioned, we keep talking about this global health security, and no one is safe until everyone is safe. And this is, I think, more than just a slogan, because as we all know now, as long as the virus continues to circulate, there will be mutation. No country is immune to really completely what's happening in the rest of the world and its neighboring countries. As we have learned from the pandemic, closing borders and lockdowns can work for a very short time, but it cannot work for economic viability. It cannot work for a long time. We all have to open up at some point. And if we don't all as a collective, as a global community, regional, of course, but as a global community, if we don't all put our hands together and try to cover the less fortunate and the vulnerable populations, specifically in our region, in Arabic, we say, al-aqrabuna awla bil-ma'ruf, people who are near you are better deserving of the good deeds. And actually, this is good now because we have Ramadan coming up, and it's a good month for good deeds. We really need to do our best to really think about the needs in the region. And as DG, Dr. Tedros, he was very strong, I guess, in his messages and calling against vaccine nationalism and hoarding vaccines and trying to spread the goods. I think this is going to be very critical. We rely on the goodwill and the goodness of many of the countries in our region to cover other needs, especially in our region, as we have immense needs. And since we have a moderator from The Economist, I would like to just end with this quote about the importance of investing in overall prevention and preparedness efforts. As you all know, I'm sure you've heard the figures. So far, it was estimated that the pandemic has cost the world $11 trillion, and we are expecting another $10 trillion. But in terms of preparedness, we estimate that it costs globally about $5 per person, actually, to ensure countries are adequately prepared. So at the global level, the whole investment in preparedness is about 14 billion only, compared to over $20 trillion what this single pandemic has cost us. And so I hope that, again, I'm happy to answer additional questions because I'm sure there are lots of things I didn't cover, but we will continue to do our best to support all countries in our region, not just the countries that are in conflict. And the one last thing I wanted to mention, since it was commented on, is the production capacity for vaccines in the region. I think Simon mentioned that this is an area that needs special attention, of course. And our region used to be much better off. Actually, 20 years ago, we had more capacity for vaccine production. Right now, we have only 4 countries in the region that can produce vaccines from scratch, although none of them had managed to make pre-qualified vaccines. And we do have additional countries. So the 4 countries are Egypt, Iran, Pakistan, and Tunisia. And we are very happy to have now Saudi Arabia that has vaccine production capacities, mainly focusing on packaging. Just heard about the UAE also initiative, which is great. Also for vaccine, more right now for vaccine packaging. But we in the region have really heard this requests from the countries very closely. We are coordinating now, and you will hear soon, a regional initiative to revamp vaccine production in the region because it's not even financing. It's about having all the systems in place to get that capacity in the region so that we cannot rely, we learned in this pandemic, we cannot just rely on the global goodwill. We need to have our own self-sufficiency in terms of vaccine production for the region and for other countries around us. And hopefully, I think we have enough. I feel strongly, actually, that we have enough capacities in the region, technical, financial resources. We just need more coordination and more guidance on the whole process. So we're in the process of putting a regional roadmap right now to move ahead with vaccine production in the region, inshallah. Thank you. Over to you.
Okay, thank you, Dr. Rana. And I had a whole list of questions that I hope to go through with all of the panelists, but we're out of time, unfortunately, because you all had a lot of very interesting things to say about distribution in individual countries and across the region. So thank you very much for taking the time and joining us this afternoon. And I hope the next time we do this, we can actually do this in person instead of behind a screen. Thank you very much to all of our panelists, Drs. Mariam, Hani, and Hussein, Ghassan, Simon, and Dr. Rana. Thank you for joining us, and thank you to everyone watching. Have a good afternoon.
Thank you.
Thank you.
Thank you.
Thank you. Bye.
Thank you all.
To watch all the sessions from the World Immunization and Logistics Summit, click the link